Hi, everybody. It's Steve Ambrose from Red Hot Healthcare, and I wanted to go ahead and take some time to introduce you to a new show that I've created called Hot Takes. Now, Hot Takes takes thought leadership from healthcare's leading voices and the industry luminaries that we all know, puts it together, and delivers it to you, the viewer, in under 10 minutes a show. There's no softball questions, there's no sales enablement, and I'll be your host. Now, today's hot take is from Rohan Kulkarni. Rohan leads the Healthcare and Life Sciences Research segment for HFS Research. And welcome to Hot Takes, Rohan. I know you stay really busy, so thanks so much for making the time.
Thanks, Steve. Appreciate it.
Well, great to have you aboard. Let's go ahead and just jump right on in. You wrote a recent piece for HFS that analyzed the scale and the speed of vertical integration that we're all really seeing happening now across healthcare. So, if we're looking at the major players, the traditional and the non traditional companies in healthcare, I'd like to know what you see as the different archetypes in vertical integration, as well as maybe some of the value propositions and the bigger opportunities that you see at play here.
Absolutely. Thanks, Steve. Appreciate it. Yes, I mean, you alluded to the recent research piece that I wrote. We identified three very specific archetypes. The first one being the ecosystem connector. The ecosystem connector really aspires to connect the entire healthcare ecosystem, particularly the funding, the primary care, through a very robust set of technologies and services. The best benefit that they will be able to address is the entire all three attributes of the triple aim of care, which is to reduce the cost of care, improve health outcomes, and enhance the experience of care. And some very specific examples in that archetype are United Healthcare's Optum and Highmark and Allegheny Health and Engine, which is their technology and services arm. The second archetype is the orchestrator, we call them. And the aspiration of the orchestrator is to address the wellness and primary care needs to mitigate expensive and extensive acute care, particularly for senior populations. This is likely going to address the cost of care and improve overall health outcomes. And some of the examples that we see there are CVS and Aetna, Humana and Kindred, and Cigna and Evernorth. Right. And the last archetype that we identified, we call them the disruptors. This applies to a set of players who are not legacy healthcare, but they come to it from an experience of other industries such as retail, financial services, and even big tech. And their focus is to help consumers access primary care and medication for the uninsured and the underinsured, so that they can positively impact the long-term cost of care. And the most prominent high-profile examples here are Amazon, especially with their One Medical acquisition that was just completed, and Walmart.
Now, I know one thing that you're never bashful about, Rohan, and that's when you address all the peppering that we're seeing in today's healthcare industry when it comes to income inequality and inequity. So let's go ahead and talk numbers and thoughts. Give us some stats, if you could, and even some deeper meaning behind what you're seeing on each of these. And we're going to go ahead and start with income inequality.
Absolutely. But let me level set as I provide you with some stats there, Steve. We as a society don't seem to be able to agree on what challenges to solve. And that, in my opinion, is the foundation of the inequities that we're seeing. In a recent poll that Axios published, 35% of Democrats said gun violence was the greatest threat to public health. 37% of Republicans said it was opioids. To me, that essentially frames that we can't even agree on what are the challenges that impact public health. Right? That's the foundation. Now, having said that, I will tell you that gun violence, diabetes care, and SNAP are three examples I want to give you in terms of statistics. In the last 72 hours, 89 people, we've seen 89 deaths in the last 72 hours, 89 deaths due to gun violence. 222 were injured. If you look at this at an aggregate basis, 20,000 people were killed through gun violence in 2022, 21,000 in 2021, and close to 20,000 in 2020, right? So there is just, and this is just gun violence. This has got nothing to do with mass shootings and things of that nature that tend to have high profile. We just as a society seem to be pretty brash when it comes to gun violence and not being able to care enough. Second thing, when I think about inequities, right? Because again, when you double click, you begin to notice that the inequities seem to be aligned more with the minorities of our country's population. And this is true for chronic care conditions, diabetes particularly. 14.5% of diagnosed diabetes are the Native Americans who are afflicted by that, followed by 12% for African Americans as well as Hispanic. And this is generally driven by lack of access. And when I think about lack of access, I think about lack of access to education, to care, to medication, and just the fact that they can't afford it, right? Again, another level of inequity driven by sort of the racial inequalities that we see in the society. And then lastly, I'll also call out the fact that just a week and a half ago, the emergency allotment associated to SNAP, right? This is sort of the federal program where we help those unfortunate amongst us with food nutrition. Uh, 35 states have decided that they're ending that because of the end of the pandemic. As a consequence of that, 22% of benefits associated to all of the SNAP beneficiaries will be gone. Just imagine if you're living at the edge of poverty and you're just being hit with inflation that is the highest over the last 40 years, and that one little piece of help you are getting from the government is gone. To me, these are pretty powerful examples of the inequities in our country driven by the fact that we don't even agree on what challenges we want to address.
Rohan, you also have thoughts on something that's really just in my circle of interest, and I know for many viewers, and that is a trend that we're seeing where service providers are really, in many cases, ignoring the needs and the market of self insured employers. So I'd like you to address that a little bit. What's it all about? And what's the big miss that's happening with that?
Absolutely. So let me give you another big number. 92% of all large employers, that is, employers who have more than 500 employees, underwrite their employees' medical risk and therefore are self insured. So this translates into some 84 million of the 330 million Americans are insured by their employers' underwritten plans, right? And this is a segment that's growing at about 3% CAGR. That enrollment has been increasing as more and more employers, as I was telling you earlier, are seeing less value in working with commercial health insurers and are beginning to look at other sorts of participants who can help them with their employees' care, health and care needs, right? Just not health care, but health and care needs. And so, as a consequence of that, commercial insurers are beginning to diversify their revenues, which is why we're seeing a lot of vertical integration, right? These are all kind of connected, if you would. Now, to address your very specific question, service providers are faced with a couple of different challenges. One is what I would say is the fact that they have a lot of existing business with their commercial health insurance and are unable to look beyond the horizon about what is coming. That's number one. The second part of that is they don't know what to sell to self-insured employers. They're very good at addressing claims insurance, claims processing, or billing or customer service, but they don't know what it is that they can be selling to self-insured employers. And thirdly, I would say is the way they're organized. What I mean by that is most service providers go to market by industry. In order to sell to self-insured employers, your healthcare industry or healthcare vertical has to become a horizontal, and that is not something that they can do on a dime, right? Which is part of the struggle. And so I continue to have these conversations with them. I continue to be puzzled by the fact that they are shying away from a $600 billion new services market. And so we will see over the next couple of years as to whether they will wake up to the reality that their main business has been declining and that they need to diversify their thought process, their product management, as well as their revenues.
Thanks, Rohan. It is always great to catch up with you. Really appreciate you making the time.
Absolutely. My pleasure, Steve. Nice talking to you again.
And thanks to those watching and listening. You can subscribe to Hot Takes by going ahead and visiting redhothealthcare.com. Thanks so much. Have a great rest of your day.